Sounds good.
She's mostly doing it when she's like scared or excited.
Scared or excited? Okay. Just to go over a little bit of history, make sure I didn't miss anything.
Yeah.
So Zoe's otherwise eating, drinking, still playful.
Yeah.
But as of yesterday morning, you kind of heard her coughing or gagging in her crate, correct? And there's no toys or material in her crate that she could get into. So you noticed it yesterday morning. How often would you say her coughing is?
Comes like each 20 or 15 minutes sometimes.
Okay. And that's how it sounds usually. No changes came. And is there any new aerosols in the environment? So new scents, strong laundry detergents? Does anyone smoke in the household? No. Okay, perfect. And just to confirm, she hasn't been around any other dogs. And there's no other, is there any other dogs in the household?
No.
Okay. Just gonna see. Hi. You're just trying to bite me the entire time. Just trying to have a feel. So definitely her lungs and heart sound good. I'm not hearing any abnormal lung sounds, so that's good. Do you notice if the coughing is when she gets excited, if she's drinking water, eating food, any association with any behaviors, or just quite random and sporadic?
I don't know. I feel like it's random. I don't hear it when she's eating or drinking. That's just me. But like she's excited when I'm getting her out of her crate in the morning, and it's more persistent then. But like even on the way down here, she's just chilling, lying there, and she starts coughing.
Yeah. I suspect it is an upper airway, whether that be, so different causes can be infectious. So we asked about being around other dogs. From different viruses. And then as well as just irritation of the trachea. In smaller breed dogs, we worry about collapsing trachea, where their trachea becomes irritated and it can collapse, and then that's when they cough to try and open their airway. It is common in small breed dogs. Usually it is seen when they're a little bit older, but can be something that's causing her to be coughing. And then as well, we worry in young dogs about like a foreign body being stuck in their throat.
That's what I was.
That's causing it. I might take her to the back, get one of the girls to hold, and just try and have a good look with a speculum at the back of her throat to see if I see anything obvious. And then we can kind of discuss where to go from there.
Sounds great. Thank you.
Could you grab like a little speculum or light? I'm just going to try and get you to hold her and do a good oral exam on her. Hello. Hi. If I can grab onto anything. Oh my god, she's so small. It's so hard to handle. All right. So I got a bit of a better look at the back of the throat, but of course her tongue, and it is difficult to kind of get a good look. So I'm not seeing any obvious foreign body. I'm kind of feeling her trachea, and she's not, she did cough in here when I was feeling it, but out there she wasn't. It could be the collapsing trachea that's causing some inflammation or irritation, and then as well as other causes of inflammation in the trachea. And then to rule out a foreign body stuck in her trachea or upper airway, we would have to do x-rays. And then if there's any evidence of a collapsing trachea, sometimes the collapsing trachea is what we call dynamic. So it collapses and then opens up again. So we don't necessarily always see it on x-ray. But we can also take a look for that as well. But I'll quickly...
That collapse in airway, is that like something that will go away?
It can be lifelong, and so it's more so managing it. So like I said, decreasing the irritants in the household, so no strong aerosols.
They do that.
Perfect. And then just managing, so a harness versus a collar, so that there's no pressure on the neck is the main kind of thing. And then we can add on medications later in life if it is if it's that and it's causing issues as well. And so, as I suspected, I do suspect it's some tracheal inflammation that's going on to cause the coughing.
Okay.
I'm going to send home some anti-coughing medication to kind of see if that improves the clinical signs.
Okay.
And then I would carefully monitor over the next 3 to 5 days. Of course, if her appetite or energy decreases at all, I do recommend bringing her in and doing a recheck exam. And then just kind of keeping a close eye on her and see if with the medication if it improves or not as well.
Great.
Otherwise, she did really good in the back.